He almost did not come in. That is the thing that stays with me about Richard. 71 years old, retired civil engineer, the kind of man who had spent 40 years solving problems methodically, logically, without panic. When something was wrong in his world, he assessed it, determined whether it warranted action, and acted accordingly. He applied the same framework to his own body. For about 4 months before I met him, Richard had been noticing things, small things, things that did not quite fit his normal baseline, but that never crossed the threshold he had set in his mind, for what counted as serious enough to call a doctor about. He had been tired in a way that felt different from ordinary tiredness. He had noticed something happening when he climbed the stairs to his bedroom at night that had not been happening a year ago. And there had been something else, something he almost did not mention when he finally did come in, something he had been explaining away for so long that saying it out loud felt almost embarrassing. His wife had made the appointment. Richard had agreed to come largely to reassure her. When I reviewed his results that afternoon, I sat very still for a moment before I walked back into the examination room. Richard's heart had been struggling silently for months. The 3 signs he had been living with and dismissing were not minor. They were his heart's way of asking for help in the only language it had available. And he had been answering that language with reasonable explanations and a determination not to make a fuss. My name is Dr. Calvin Hayes. I am a cardiologist, and I have been in clinical practice for over 20 years working exclusively with patients over 60. Richard's story is not unusual in my world. It is, in fact, the story I encounter more consistently than almost any other, not the dramatic chest-clutching emergency that popular culture associates with heart disease. The quiet, gradual, easy-to-rationalize accumulation of signs that most people over 60 are not taught to recognize for what they actually are. I want to teach you today, because Richard almost did not come in, and the people who most need to hear what I am about to share are almost always the people most likely to decide that it probably does not apply to them. Stay with me, because the 3rd sign on this list is the one that stops people cold when they hear what it actually means, and it is the one that Richard almost did not mention. The 1st sign is a new kind of tiredness that sleep does not fix, not ordinary fatigue, not the tiredness that comes from a busy week or a poor night's sleep or the general slowing down that people associate with getting older. I am talking about a specific quality of exhaustion that feels different from anything you have experienced before. A heaviness that is there when you wake up and that does not lift the way tiredness normally does after rest. An energy deficit that seems disconnected from how much you have done or how much you have slept. Most people over 60 attribute this to age, and I understand why. Fatigue is so commonly dismissed as a natural consequence of getting older that questioning it feels almost unnecessary. But here is what I need you to understand about what this specific kind of tiredness can mean inside your cardiovascular system. When your heart is not pumping as efficiently as it should, whether because of developing heart failure, significant arterial blockage, or a rhythm problem that has not yet been diagnosed, your muscles and organs receive less oxygenated blood than they need to function at their normal level. Your body compensates for this reduced oxygen delivery by reducing your energy output. It prioritizes, it redirects what resources it has toward the most essential functions and away from everything else. The result is a profound, persistent fatigue that has nothing to do with how much you slept and everything to do with how efficiently your heart is doing its job. A landmark paper published in the European Journal of Heart Failure identified unexplained fatigue as one of the earliest and most consistent symptoms reported by patients in the months before a heart failure diagnosis. Not chest pain, not dramatic breathlessness, tiredness, the kind that people live with for months attributing to age, stress, or simply the way things are now. Richard described his tiredness to me as a flatness, like someone had turned down the dial on everything. He had been sleeping 8 hours and waking up feeling like he had slept 4. He had assumed he was depressed. He had considered speaking to his family doctor about it. He had not yet done so because he did not want to seem like he was making a fuss about being tired. I want you to think about the tiredness in your own life right now, not the tiredness from a long day or a busy week, the baseline tiredness, the energy you have when you wake up in the morning. Has that changed in the last 6 to 12 months in a way you have been quietly explaining away? If the answer is yes, that change deserves a conversation with your doctor. Not because it is definitely your heart, but because it is information your heart may be trying to give you, and you deserve to know what it means. Now I want to tell you something that connects this first sign to the second one in a way that most people never hear explained clearly, because they share the same root mechanism inside your cardiovascular system. And understanding that connection will make the second sign make sense in a way it probably never has before. The second sign is shortness of breath during activities that used to be completely effortless, not breathlessness from running or from something physically demanding. I am talking about the kind that arrives during ordinary activity, climbing one flight of stairs, walking from the parking lot to the entrance of a grocery store, carrying a bag of laundry from one room to another. Activities that a year ago or 2 years ago required no particular effort and that now leave you needing a moment to catch your breath before continuing. Almost everyone I speak with who experiences this attributes it to being out of shape, to not exercising enough, to getting older. And I want to address that assumption directly because it is one that delays diagnosis in my patients more consistently than almost any other. Being out of shape produces breathlessness during genuinely demanding exertion. What I am describing is different. It is breathlessness during activities that make no significant aerobic demand, activities that should not wind. When breathlessness arrives at that level of exertion in an adult over 60, it is a specific clinical signal that warrants investigation. Here is the mechanism that connects this sign to the first one. When your heart is not pumping efficiently, your body delivers less oxygen to working muscles. Those muscles fatigue more quickly than they should. Additionally, when the left side of the heart is under strain, pressure backs up into the pulmonary vessels, which are the blood vessels that run through your lungs. When pressure builds in those vessels, fluid can leak into the lung tissue itself. Fluid in the lung tissue makes breathing feel harder. The result is breathlessness that seems out of proportion to what you are actually doing physically. A study published in the American Journal of Cardiology found that exertional dyspnea, which simply means breathlessness during physical activity, was present in over 60% of patients subsequently diagnosed with significant cardiovascular disease, and that the majority of those patients had attributed their breathlessness to deconditioning or aging for an average of 8 months before seeking medical evaluation. 8 months of a sign their heart was sending, explained away. Richard told me that climbing the 14 stairs to his bedroom had started requiring a brief pause at the top. He stood there each night catching his breath for 20 or 30 seconds before continuing to the bathroom. He had decided the stairs were steeper than he remembered. He had considered whether the house might benefit from a stair lift at some point in the future. It had not occurred to him that his heart was the variable that had changed, not the stairs. If you have been pausing at the top of a flight of stairs, stopping more than you used to on a walk, or noticing that activities requiring minimal effort are now leaving you slightly breathless, I am asking you to take that seriously. Not with alarm, with the same calm, methodical attention that you would give any piece of information that might be important. We are now at the third sign, and this is the one I want you to hear most carefully, because this is the sign that Richard almost did not mention, the one he had been living with and explaining away the longest, and the one that in my clinical experience carries the most important diagnostic information of all three. The third sign is swelling in your ankles, feet, or lower legs that is present in the evening and may be gone by morning. This is the sign that most people notice and almost nobody reports. Because it seems so minor, because it comes and goes, because there are so many innocent explanations available. You were on your feet too long, the weather was warm, you had too much salt yesterday, your shoes were tight, and sometimes those explanations are correct. Ankle swelling has many causes, and not all of them are cardiac. But here's what I need you to understand about the specific pattern of evening ankle swelling that is present in someone whose heart is struggling silently. When the right side of the heart is not pumping efficiently, blood returning from the lower body backs up in the venous system. Pressure builds in the veins of the legs and feet. That elevated pressure causes fluid to leak out of the blood vessels and into the surrounding tissue. Gravity pulls that fluid downward. It accumulates in the ankles, feet, and lower legs during the hours you are upright. When you lie down at night, the fluid redistributes. By morning, it may be largely gone. And you conclude there was nothing seriously wrong because the swelling resolved. But the resolution of the swelling overnight does not mean the cause has resolved. The cause is the heart working against elevated back pressure every day. The fluid moving around is simply the visible evidence of that pressure, and its daily return each evening is a pattern worth paying attention to. Research published in the Journal of Cardiac Failure found that peripheral edema, the medical term for this type of fluid accumulation in the extremities, was present in a significant proportion of patients with undiagnosed heart failure for months before formal diagnosis, and that patients consistently attributed it to non-cardiac causes during that period. Richard told me that his ankles had been swelling every afternoon for approximately 5 months. By the time he went to bed each night, his socks left visible indentations in his skin. Each morning the swelling was largely gone, and he had concluded it was not serious. He had mentioned it to his wife once, and she had suggested he reduce his salt intake. He had done so without any change in the swelling pattern. He had not mentioned it to a doctor because it seemed too minor to warrant an appointment on its own. When I put Richard's 3 signs together, the persistent fatigue that sleep did not, the breathlessness on the bedroom stairs, and the daily ankle swelling that had been present for 5 months, the picture was clear enough that I ordered an echocardiogram that same day. The results confirmed what the signs had been communicating for months. Richard's heart was struggling, not in crisis, but struggling. And the struggling had been going on long enough that without intervention it would have progressed to something significantly more serious. Richard is doing well now. He is on the right treatment, his energy has improved, the stairs no longer require a pause, the swelling has resolved. But what I think about when I think about Richard is the 4 months before he came in. The 4 months his heart spent sending signals he had been given no framework to interpret correctly. I am giving you that framework today. If you are experiencing any one of these 3 signs, I am not asking you to panic. I am asking you to make an appointment, to describe specifically what you have been noticing and for how long, to give your doctor the information your heart has been trying to communicate. Because the difference between catching something at the stage Richard was at and catching it 6 months later is a difference that matters enormously in terms of outcomes, treatment options, and the trajectory of the rest of your life. Your heart has been showing up for you every single day, every beat, every quiet adjustment, every moment of work you never notice because it happens without your awareness or your effort. It deserves the same attention in return. Which of these 3 signs have you been living with and explaining away? Tell me honestly in the comments below. Your answer may be exactly what someone else reading along needs to take their own signs seriously, and that comment could matter more than you know. Please share this video with someone over 60 you care about, not to alarm them, because this is the kind of information that prompts the appointment that changes the outcome. And that is the most important thing a video can do. Subscribe because my next video goes directly into what happens at that appointment. The specific tests that reveal how your heart is actually functioning, which ones matter most, and the questions to ask your doctor to make sure nothing important gets missed.